Welcome to Module 3, Laboratory Personnel, Certification, Licensure, and Accreditation. One of the focuses will be on laboratory personnel, where you will be in the ladder once you achieve your degree as an MLT, and where you can go after that. The Department of Pathology is divided into two separate divisions, anatomical pathology and clinical pathology. Each section performs very specific tests or testing and has a variety of personnel requirements. The first laboratory professional I wish to talk about is the pathologist. The pathology department, both anatomical and clinical, is overseen by a pathologist. This is a medical doctor who has completed 4 or 5 years of residency, 4 for anatomic pathology only, 5 for a combined anatomic clinical pathology residency. Those who complete a pathology residency are eligible to become board certified by taking the American Board of Pathology Certification examination. The first division we're going to talk about is anatomical pathology. This area of pathology relates to the processing, examination, and diagnosis of tissue specimens. There are 2 main subdivisions within anatomic pathology: histopathology and cytopathology. These will be discussed on the following slides. Histopathology involves examination of intact tissue, biopsies, or resections. This is often aided using special staining techniques and other associated tests, such as using antibodies to identify different components of the tissue. Cytopathology, which includes cytology, is the examination of single cells or small groups of cells. A common cytology test is the fine needle aspiration biopsy. The FNA is relatively painless, fast, and inexpensive. This method is applicable to palpable lesions, such as lesions to the breast, thyroid, lymph nodes, as well as pediatric lesions. A diagnosis is usually rendered within minutes rather than days. When my mom felt a lump in her breast and she went to the doctor, in the office they did the FNA, and within a short period of time we received the diagnosis of cancer. And it's much better than waiting, days, if not weeks, for test results to know it right away. One of the most commonly performed cytology tests is the cervical pap smear. This is to diagnose cervical cancer. There are a wide variety of laboratory professionals who work in anatomic pathology, and they include histotechnicians, histotechnologists, cytotechnologists, and pathologist assistant. I want you to be able to give a brief description of what the profession is and the educational requirements to become those laboratory professionals. There are many other professionals who work in the department, but these are the individuals who are involved in the analysis of tissues. Histology is the science dealing with the study of the microscopic structure of cells and their formation into tissues and organs. Histotechnology is a science centering on the microscopic detection of tissue abnormalities for disease diagnosis and the treatment of diseases utilizing specific reagents, chemicals, and dyes. Histotechnology is the process for preparing tissues, including grossing, where they'll take a piece of tissue and slice it up, fixation, to permanently fix or preserve a sample, processing, which usually includes embedding in paraffin, which is a wax. Once it's in this wax, it has a solidity to it, and then sectioning of the tissue can be done using a microtome, which produces very thin ribbons of tissue which are placed on glass slides, and finally staining the tissue with different chemicals. The stains used vary according to the body tissue being examined. The different tissues, liver, lungs, other types of tissues, they will all have different chemical makeup and will absorb different stains in different ways. And the main thing we want to do is have this single layer of cells which are stained so that they can be evaluated. The two professionals that work in histology are histotechnicians and histotechnologists. The histotechnician requires an associate degree from an accredited histotechnician program, followed by taking the National American Society for Clinical Pathology ASCP Board of Certification BOC exam. The histotechnologist requires a bachelor's degree in an accredited program and ASCP BOC certification. Histotechnician and histotechnologist educational programs are accredited by the National Accrediting Agency for Clinical Laboratory Sciences, also known as NACLS. The cytotechnologist works directly under the direction of a pathologist. The cytotechnologist is the individual who examines cellular samples under a microscope to determine the presence of disease. They are involved in the diagnosis of cancer, precancerous lesions, benign tumors, and infections from a wide variety of body sites. The most well-known screening test performed and read by the cytotechnologist is the Pap smear. The educational requirements to become a cytotechnologist are a bachelor's degree and completion of an accredited cytotechnology program, which includes instruction and clinical training in the field. The bachelor's degree may include the cytotechnology training, or an individual with a bachelor's degree can complete the requirements of the school for cytotechnology. This is called a 4+1. After completion of an accredited program, students are eligible to take the ASCP BOC exam to become certified as a cytotech. A pathologist assistant is similar to a physician's assistant. Under the direction and supervision of a pathologist assistant will perform gross examination of surgical specimens, as well as performing forensic, medical legal, and hospital autopsies. The educational requirements are completion of a master's degree program for pathology assistants. The programs are accredited by NACLS, and graduates must take the AACP certification exam to become a pathologist assistant. So we've just discussed all of the professionals that are involved in the anatomic side of the pathology department. Now we're going to talk about clinical pathology, and this is where we live. There are a variety of professionals who work in clinical pathology. The number and type of laboratory professional will vary depending upon the size of the institution. The following laboratory professions will be discussed: phlebotomist, clinical laboratory scientist, medical laboratory technician, medical laboratory scientist, and the most exciting degree, doctorate in clinical laboratory science. If you're working your way up the career ladder to become an MLT, you may be working as a phlebotomist. These are individuals who collect blood samples from patients. They provide patients with instructions on obtaining other types of samples such as urine, and they may accession and process samples in the laboratory. This job requires attention to detail, with the most important part being proper identification of the patient. The phlebotomist must ensure that the blood is collected into the correct tubes. There's many different types of tubes with different color stoppers, and each color stopper has a different type of chemical in it. So it's very important that they be collected in the proper order. They have to be labeled properly, not just with the last name. How many Smiths are in this world? But there is a prescribed amount of information that must be on every tube of blood. A lot of places have labels where the phlebotomist will carefully attach the correct label to the correct tube of blood. And then they need to transport it in a manner that will not negatively impact the sample. For example, some samples must be protected from light. For example, bilirubin exposure to light will decrease it and can give a false diagnosis. They have to be kept chilled to keep the components in their natural form. For example, ammonia. If you don't chill it, then the ammonia can escape and give false negative reactions. Or kept warm to maintain the integrity of the sample. For example, cold agglutinants. If they get cold, they attach to cells and we'll see a false decrease. So phlebotomy is not a simple job. and take into account having to stick all these different types of veins and utilize different types of equipment. Phlebotomists may work either in draw stations where all they do is draw the blood and then process it, or they may be responsible for accessioning as well in large hospital labs. This is the process of ensuring that samples received in the laboratory are collected in the correct tubes for the test ordered, labeled appropriately, and that all necessary samples for tests ordered have been submitted. For example, if we receive an orphan sample with no orders, we can do nothing with that sample. Blood tests cannot be performed unless a doctor's order is received. So if we have a sample, we'll hold on to it, but nothing will be done. And where it came from, we'll be contacted to see if maybe they forgot to put in an order. Processing of samples involves centrifuging samples in a machine which spins the blood at a high rate of speed to separate the liquid portion of blood from the cells. So during this centrifugation process, all the heavy elements go to the bottom, which are your red cells, white cells, and platelets, and the liquid portion is on top. And depending upon what kind of tube, you either have plasma or serum. The phlebotomist may then remove a small amount of an aliquot of the liquid and place it in a properly labeled aliquot tube for testing there in the lab or to be sent out to an outside reference lab. Not all labs can do all tests. It would not be cost effective. So those tests that are not ordered very often, an aliquot of the patient sample is sent to a reference lab. Phlebotomists may be trained on the job, which is absolutely not ideal because bad habits carry from one badly trained phlebotomist to another. The best process is to go through a formal training program and obtain a certificate of completion. Phlebotomy training programs may be located in colleges, and usually they're associated with MLT programs because we're trying to create a career ladder, and most MLT programs will require phlebotomy as a part of the admissions requirement. Or a phlebotomy program can be standalone. Some colleges have phlebotomy programs, but they don't have MLT programs, which is perfectly fine. After appropriate training or work experience, individuals are eligible to sit for national certification exams, and there are several, with ASCP being the most sought after. And then once they pass it, they become certified. So when you receive a certificate, that does not mean you are certified. And people get confused about this all the time. And I'll talk about this again at the end of this presentation. So you go through a formal training program to earn your certificate. Your certificate qualifies you to become certified. Many phlebotomy programs attain accreditation from the National Accrediting Agency for Clinical Laboratory Science, NACLS. The accreditation process is rigorous and ensures that the program meets the national standards for the education and training of individuals in the program. I do want to interject a note here. Previously, phlebotomy programs and clinical laboratory assistant programs were approved by NACLS. In 2022, the decision was made to remove approval and require all programs to be accredited. The next laboratory professional is a clinical laboratory assistant, or CLA, and they perform phlebotomy duties as well as duties in other departments, such as in microbiology, they may set up the cultures by streaking samples onto appropriate media for growth. In hematology, they may load samples on the analyzer and prepare and stain blood smears for examination. In chemistry, they may load the samples onto the analyzers, with the rest of the analysis being done by credentialed individuals. Urinalysis, they may be allowed to perform chemical testing on urine using reagent dipsticks. Coagulation, they may be allowed to load samples onto the analyzers and then perform other CLIA wave tests. And usually these are kit tests like strep test or COVID tests. Anything that is CLIA waived, a clinical laboratory assistant with appropriate training can perform. CLAs are usually hired by very large clinical laboratories which are located in hospitals or reference laboratories, which have a very large number of specimens to process and analyze. They play a vital role in performing tasks that then free up technicians and scientists to devote their time on the non-wave testing. CLAs may be trained on the job or go through a formal training program to obtain a certificate. CLA programs may be located in colleges or as standalone programs. They may pursue NAACL's accreditation. After appropriate training or work experience, individuals are eligible to sit for national certification exams to become certified. Again, you earn a certificate which makes you eligible to become certified. The medical laboratory technician, or MLT, is an individual who is trained to perform waved and non-wave testing in every department of the clinical laboratory. The training programs are located in colleges and include classroom, student laboratory, and clinical training. Clinical training is very important, as that's where you actually go out to laboratories and get your skills polished up to where upon completion of the program you have entry-level competency in all basic tests that are performed in the laboratory. These individuals earn an associate degree in medical laboratory technology. All reputable MLT programs are accredited by NAACLs. I don't know of any program in the United States which is not, but you want to be really careful and make sure that your program is, because accreditation is a rigorous process that ensures that programs are in compliance with national educational standards for laboratory education. It requires a site visit where the accrediting agency volunteers ensures that the program does meet national standards for quality instruction. I want to re-emphasize that MLTs, by education and certification, are qualified to work in all areas of the clinical laboratory. There may be some hospitals or some areas of the country where they won't let MLTs work in blood bank or micro, but this is their loss because you are trained to work in those areas, and I've known many individuals who play supervisory roles in those extremely technical areas. The MLT performs analysis on blood and body fluids obtained from patients to aid in the diagnosis and treatment of diseases. They may work in a variety of facilities, including doctors' offices, clinics, hospitals, manufacturing, research, zoos, and many other places. I encourage you to work 2 years in the field, and then if you're not happy with your situation or your setting, look in the private sector for jobs, because your skills are very, very transferable to a lot of different professions. Testing in the laboratory is performed under the direction of a pathologist or medical laboratory scientist. After earning your associate degree, these individuals are eligible to sit for national certification exams. Again, there are several out there, but the most recognized by the laboratory is ASCP BOC. The Medical Laboratory Scientist, MLS, is the baccalaureate level of clinical laboratory practice, and we have changed our name so many times over the years. When I graduated, it was medical technologist. Nobody knew what we did. So then we changed it to clinical laboratory scientist, thinking pieces would go together in folks' minds, but nope. And our final name, which I think has been maybe 10 years, is medical laboratory scientist. And people do seem to be able to put the pieces together to know that we work in medical laboratories as scientists. The training programs are located in universities or hospitals, and students are awarded a Bachelor of Science or certificate upon successful completion of their training. So universities, it will always be Bachelor of Science. Hospital-based programs may be affiliated with a university, which then awards the MLS degree, or the hospital may offer opportunities for students with a baccalaureate degree to go through their one-year program and receive a certificate of completion, which then allows them to sit for their boards. All reputable programs are accredited by NAACLs. These individuals have the same qualifications and training as an MLT, but include management and research. In the laboratory, they may supervise MLTs and CLAs, perform research and data analysis, interact with other healthcare professionals in a hospital or clinic setting, and perform higher-level skilled duties within the clinical laboratory. They may hire, they may fire, they do the ordering, but just a lot of upper-level things. MLTs are the workhorses, and then MLS are usually the supervisory personnel. The last professional we're going to discuss is the doctorate in clinical laboratory science. This is the newest level of practitioner in the clinical laboratory, and it's so exciting. This is a terminal degree, and it's an advanced professional doctorate designed for practicing MLS who wish to further their level of clinical expertise and to develop leadership and management skills. The purpose of the program is the development of clinical laboratory science graduates who function as practitioners, community leaders, educators, and scholars in the profession of clinical laboratory science and the discipline of clinical laboratory science. Graduates of the program will generate, disseminate, and apply knowledge to enhance the understanding of laboratory assessment of health and disease. So these individuals, during their training and as a practitioner, actually go on rounds with the doctors, and their role is to discuss the laboratory results, analyze the results, apply them to the patient's clinical history. In fact, one of the first DCLS graduates was on rounds, and they were going to postpone putting in a pacemaker on a paraplegic because they thought he had pneumonia. When the DCLS analyzed the microbiology report, said no, this is most likely contamination from the tube used for the respirator. So when they did some additional testing, they found that that was true. It was a contaminant. It was not pneumonia. It saved tens of thousands of dollars in hospital stays, medications, and the patient was able to get their pacemaker the next day. The first program in the U.S. accepted students in 2014. That wasn't that long ago. And graduates of the DCLS program are prepared to be effective leaders in many facets of clinical laboratory science profession, particularly in advanced roles. So the pathologists, really what they want is the anatomical side. They really don't want to have much to do with the clinical side, because that means keeping up with all the laboratory tests that are coming out, interpretation, relaying this to physicians and patients. So what better role for this doctorate to play than to step in on the clinical side and be the laboratory director and answer questions from patients and from colleagues who are physicians. My most exciting story is we had an MLT who graduated a long time ago. Then she went on to get her bachelor's degree, and that is a requirement. You have to be an MLS certified by AASCP to enter the DCLS program. And then she entered the program, and now she is the lab director of one of the biggest physician office laboratory systems here in Austin. And I'm just so very proud of her from going from that MLT to a practitioner in our field. The DCLS programs are located in universities, and students are awarded a PhD. NACLS has just now completed the accreditation process, and UTMB, University of Texas Medical Branch at Galveston, is the first program in the U.S. to receive accreditation through NACLS. Our last topics are certification, licensure, and accreditation. Certification, I still want to reemphasize this because this is really confusing for many people. They think that once they have earned a certificate of completion, such as one awarded for completing a phlebotomy program, that they are certified. It's very confusing because the terms are very similar. Certified versus certification. To become certified, an individual must take and pass a national certification exam. The exam will demonstrate that an individual has entry-level knowledge and skills to practice a certain profession. So again, certification is simply getting your certificate. Certification is when you take that national exam. There are several agencies which certify laboratory professionals, but the one most recognized by the laboratory community is the AACP Board of Certification. AACP is considered the gold standard for certifying laboratory professionals. Gold standard is something that serves as a standard by which others may be measured or judged. So it's top of the line, and other certifying agencies wish they could be ASCP. It was the first organization to certify laboratory professionals starting in 1928. It is the largest certifying agency and now broadened its scope to certify individuals internationally as well. For example, in China, they can now take the ASCP. So if you see somebody with ASCP-I, that means ASCP International, that they achieved their certification and their credentials from another country. All individuals must meet clearly defined educational and/or experience in the profession they wish to be certified in. Licensure. Unfortunately, laboratory testing can be performed by individuals who do not possess education and training in clinical laboratory procedures. CLIA has watered down educational requirements for individuals to qualify for laboratory positions, which infuriates us. So anyone with a bachelor's degree, theoretically, and they must be properly trained, can perform work in a clinical laboratory. Will most laboratories hire you? No. Most reputable laboratories will only hire individuals with the proper credentials, MLT, MLS, etc., and certification. To ensure that laboratory professionals have the proper credentials, 11 states have instituted licensure and 1 U.S. territory. And these are bills that strictly define the qualifications for those individuals who may work in a clinical laboratory. State licensure requires minimum education requirements as well as certification. At this time, there are only 11 states and 1 territory that require licensure. And finally, accreditation. NACLS has been mentioned repeatedly in the information in this presentation. This is the premier organization for accreditation of educational programs in the clinical laboratory sciences and related healthcare professions. NACLS has established national education standards for each profession. Accreditation is a process for programs awarding certificates and/or degrees in laboratory education to document and prove that the program is in compliance with the national standards set by NACLS. Prior to 2022, the clinical laboratory assistant and phlebotomy technician programs were approved. The approval process only required a self-study report. And I say only because this is a really huge document that documents the quality of your program. And this had a maximum award of 5 years. In 2022, NACLS decided that all laboratory science programs should be accredited. So they removed the approval process. Accreditation requires a self-study and a site visit. The self-study is an extensive written report providing a description and documentation which proves that the program meets the standards for the specific program accreditation is sought. I have written so many of these because I've been over different educational programs, and it takes a year, especially because you're working and teaching and doing other stuff. But it is a very comprehensive document that documents the quality of your program and that you are meeting the standards. The program then undergoes a site visit where NACLS representatives visit the program and ensure that what was presented in the self-study is true and factual. You cannot tell me that you have 16 microscopes and I arrive on site and there's 4 for 12 students. So that would be a citation. because you're not doing what you said. You don't have the resources for the number of students that you have acquired. Initial programs for accreditation receive a maximum award up to 5 years. It could be less. And continuing programs, reaccreditation, may receive an award up to 10 years. And again, it may be less if certain standards are not met. So this is the end of the presentation, and be sure to fill in your objectives. I know I sound like a broken wheel, but that is the best way to make an A in this course on your exams.